Hi, I welcome everyone to another episode of Zoom In on the Halal Metropolis, where the Halal Metropolis team from the U of M Dearborn and the University of Michigan Ann Arbor do our best to document, keep track of what's happening to the Muslim community of Detroit during the pandemic. And I'm Sally Howell. And today I'm visiting with Abdullah Hammoud, State Representative Abdullah Hammoud. How are you, Abdullah?
I'm doing well. Thank you so much for having me.
I really appreciate your being here. So tell me how you and your family are doing.
We're doing well. The house is just myself, my wife, and our dog, Kusa. And so,
Dog named Kusa.
people usually get a kick out of that. My wife is a physician, and so she's on the front line. High anxiety, high pressure, but all heart. And so just doing my best to try to be supportive in whatever way I can be. While at the same time trying to still do my role out of the house to assist as many people as possible.
Well, so where does she work?
She is a part of the Beaumont health system.
Oh, wow, and they're being really affected by this, I see. I mean.
Yeah, they are, and they're being pulled into, she's a second-year medical resident, family medicine, but it's all hands on deck right now. So they're pulling them in as, where they need them, various hospitals, moving them from place to place, just doing all that they can to assist those and help in healing.
Well, I hope that she stays healthy. I'm just terribly curious about, another group of people who are on the front line are clearly politicians. I mean, several local politicians have gotten sick, and poor Isaac Robinson, Allah yarhamu, passed away. He was one of the first people that any of us knew who was affected, who was killed by this virus. And so much of what you do is actually getting out there with the people. I see you always with the people, shaking hands, hugging people, doing selfies with people. I mean, what has it been like for you to retreat to the interior of your house?
Yeah, first and foremost, God rest Isaac Robinson's soul. That man was truly a champion of the people, and it leaves a big gaping hole in many of our hearts in the community, but also in service, because we're not going to find a champion like we had in Isaac. And several of my colleagues have been tested positive. And I think it's important to know that all of them were Detroit members. And so I think when this is all said and done, I think we need to have a deep retrospective analysis and look internally of ourselves and ask that question of why was why was Detroit so disproportionately impacted? And I think we all know there's many reasons for that. As it pertains to calling us frontline, workers and such, I would push back against that. I don't think we're as frontline as you see the caregivers, as those in civil service, or as those in other industries. But we certainly have a role to play, whether it's out of the house, to make sure people still have the information that they need. My office is really receiving two types of calls. One is dire assistance with unemployment or small business support. And the second is medical professionals or healthcare caregivers searching for PPE, personal protective equipment. And so we do our best to try to track it down, source donations, and then just make it available. So, that's really what we can do at this time. We go to Lansing on an as-needed basis at this point because we don't have the ability to vote remotely yet, unfortunately. And so that is something we're advocating for, but in the interim, it's just all constituent services for right now.
Well, when you mentioned the PPEs in particular, I've seen that the Arab community in Dearborn, the Muslim community in a larger sense, has really stepped up in terms of trying to provide support for healthcare workers and getting PPEs to them. I see massive donations coming in. I also see the small business community, especially the restaurant industry, which is being affected as much as anyone by this shutdown we're going through. I've seen them really step up and try and provide support and care for low-income families and for people in the medical profession. So would you like to say a few words about how you've seen people responding?
Dearborn is that community that even when it seems and feels and we know we have little, we find more ways to give out of ourselves and out of our pockets and out of our businesses or whatever it might be. That's just the type of community that we are. We're there without needing to call. We're simply there because giving is just a foundational element of community members who live here. And I'm so blessed to be a part of this community, having been born and raised here. And so thank you to all those who have donated, who continue to donate, even when they don't find much for themselves left at home. And I think that speaks volumes on the type of character of businesses and individuals that we have here.
Yeah, I've been impressed. Yeah, and the racial disparities that you mentioned in the way this virus is affecting people, it's been horrifying to see. And I guess it's not surprising given the fact that these disparities are, course through every part of our society. But I'm wondering, I'm wondering if you've noticed that the Arab community is also being affected disproportionately. I mean, the thing is that
I
with the
haven't
African
seen
American
any.
community, we can get data on the African American community, but there's no way for us to collect data on the Arab community because they're considered white technically, and so we don't have any data on this population.
And you nailed it. So it'd be hard to make any inferences without seeing any data that specifically highlights the number of cases amongst Arab Americans within the city of Dearborn. We know Dearborn, obviously, amongst Wayne County, excluding Detroit, has the second highest number of cases. But proportionally speaking, we're one of the the larger cities in Wayne County. So it makes sense. But I would love to see data that's specific to the Arab American population. As it pertains to racial disparities, I think there are many reasons for why African American community is hit much harder. And it's really showing all the shortcomings of government. And it's showing basically the systemic oppression that's been happening for decades. It's really poking out now. Whether we're talking about poverty being a risk factor, access to water, living in food deserts, access to transportation, access to quality health care, all these are factors and reasons for why we're seeing such high rates of mortality rates within the African American community, but also infection rates in the African American.
And I think also air quality is a big issue if you look at Detroit and the environmental problems that the city has. So
100%. I mean, environmental justice undoubtedly is attached to this. When we're talking about zip codes in South Dearborn or Southwest Detroit, the most polluted zip codes in the whole country, you have higher rates of asthma. We are the asthma epicenter, higher rates of respiratory diseases. And coronavirus is nothing more than a disease that just attacks your respiratory system, putting you at higher risk. So 100%.
Well, let me switch gears a little bit and ask you a forward-looking question. So I see you sitting alone in your basement or your living room or a very nice office that you have at home. But I'm wondering, especially if it's just you and your wife, I'm sure the two of you are socially keeping your social distance from other people and quarantining yourself from others, especially with her fragile situation with her job that she has. But how are you thinking that you're going to cope during Ramadan? Ramadan's coming up in just a few weeks, and it's the most social time of the year.
Yeah. First and foremost, disclaimer: this is my wife's office. I actually, she provides me the permission to use it. So thank you to her. As it pertains to Ramadan, it's going to be extremely difficult. I think we're all used to having large family gatherings around our dining room tables. But as you alluded to earlier, we might not have as many mouths to feed around our dining room table, but I think you're going to see a lot of Muslims step forward and feed and help feed more individuals than we ever have before. Whether that's donating food, making food, providing it to others. I still think you're going to see a large push along those lines, and there's going to be a lot of Zoom family dinners. Unfortunately, that's what's going to have to happen. We have to accommodate. We have to evolve with the times, as they say. So that's what I foresee happening. But when you cook during Ramadan, you're used to cooking for 10. Yeah. And so we haven't been accustomed yet to buying groceries for 2 and cooking meals for 2. Somehow we still overcook. We still, we're trying to, overcompensate by eating more. But that's obviously can only last for so long. Yeah. So it's going to be a tough time, but I think we'll pull.
Yeah, I also grew up in a large family, and I never learned to cook, even though my immediate family is just 3 people. Right now it's down to 2. I still cook for 6 or 8. I don't cook for 2. I just can't. But I imagine that during Dearborn, you're going to see a lot of people dropping food off on each other's porches. So that's going to there's going to be a wave of cars circulating, dropping off their covered dishes for each other to share a little bit. Well, listen, I'm glad that you're staying safe and healthy, and I wish all the best to both you and your wife if you try and get through this. And please reach out to us at the university and to the public if there are any ideas that you have or ways that we can contribute to all of these efforts that you've just mentioned. Thank you for everything that you do. Salam alaikum.
Wa alaikum salam. Thank you so much. God bless you.